Welcome to Conversations with B'nai B'rith International. I'm CEO Dan Mariaschin. Thank you for joining us today. Well, the COVID-19 pandemic has changed so many fundamental behaviors, from how we eat to how we use social media to how we work. As America's population ages and technology becomes even more ingrained in our lives on a daily basis, it begs the question, how has the pandemic changed older adults' relationship with the internet? And though we may have emerged from the darkest days of COVID, the Older Adults Technology Services, or OATS, estimated that 22 million seniors lack broadband internet at home, and that 25% of seniors are socially isolated, with the CDC labeling social isolation a serious public health risk. How are these realities possible in 2021? Well, with me to help break down how COVID-19 has changed the way older adults use technology and ways to bridge the digital divide are Breana Clark, Maria Medley, and Charee Russell, three experts on seniors issues. We'll talk about different policy approaches to increase seniors' comfort level with the internet and the ways in which the B'nai B'rith Center for Senior Services and like-minded nonprofit senior service providers are advocating for senior broadband access across the country. Breana Clark is Associate Director of Program Operations for Older Adults Technology Services, OATS. Maria Medley is Quality Assurance Director for SPM Property Management, and Charee Russell is Vice President of SPM Property Management. Breana, Maria, Charee, welcome. So glad that you could join us today.
Happy to be here.
Well, we'll start with a question for everyone. The past 16 months have been challenging for everyone, for all of us, especially since technology has become even more prevalent in our day-to-day activities. We're meeting here by Zoom. Whether participating in telehealth appointments with our doctors, video chatting with family or friends, ordering groceries, or countless other household items online, or simply relaxing to stream a movie or a TV show, many people did not have the skills to easily switch to this technology. So the question is, how were your organizations able to adapt on the fly, because that's what you had to do, throughout the pandemic to meet the needs of the people that you serve? So Breana, why don't you go first?
Sure. So, our traditional training model was in person. Senior Planet served seniors in 6 locations on the ground. And back in March, like many others, we had to pivot to virtual, all of our programs being offered virtually. So what we did to enable that to happen as smoothly as possible is we picked Zoom, as we're here today on Zoom, for a few reasons. One, it doesn't require downloading if you're using a computer, so you don't have to download the app itself. It offered the ability to call in. So for folks that did not have internet, they were still able to have that sense of connection. And then we also advertised without registration. So if we could get folks to the website, able to click on a link, which is a feat in of itself, they were able to participate. So we, not unique to just us, did a tremendous amount of outreach to those that we served in person, but also to anyone and everyone who would listen to what we were offering, which meant we were able to serve people across the country. So because we were virtual, we were no longer confined to those 6 locations. So now we're still offering everything virtually.
Maria, how did you handle it?
Well, I would say that the service coordinators in the buildings were instrumental to this initiative. They were our boots on the ground to educate residents on technology, how to use smartphones, even from behind the door, because we were trying to protect our seniors as well as the staff. So they were really the ones to provide the technical support on site on how to use a smartphone if they needed to schedule a COVID test or anything like that. So they were, crucial for that. We also used the CARES Fund Act funds to Resident Connect feature in Ask Online, which is the platform that service coordinators use. And this was used to send out mass communications to the residents because they couldn't meet face-to-face anymore. We were using this technology to send out text messaging or robocalls that were translated in their primary language. So that really was crucial for us and all the things that we were trying to let the residents know about and just communicating with them in general. So that was more on the fly. I would say that that's one of the main things that we did, as far as trying to get them to use their smartphone a little bit more, even just receiving phone calls through robocall and trusting them. So I would say those were the main two things.
Charee, how did the residents react? I mean, all of us knew that we were really in crisis mode after the first few days, and this was not going to get any better. So how did the residents react? Did they kind of step up to the plate on this and say, well, look, I see now we're going to have to do some things that we didn't do before, or get accustomed to doing some new technology things that our children and grandchildren were doing, but I wasn't doing. So what kind of reaction did you get from them?
I feel like they were fearful of it. The older generation, the older elders just feel like it's not their generation. It's not for them. It was a real challenge. And some of the younger seniors were more accepting.
Well, Breana, you previously worked for the B'nai B'rith International Center for Senior Services as a senior program associate. Welcome back. You were involved in our congressional advocacy efforts, the senior housing training conferences, as well as in creating a technology guidebook for our senior housing residents. Can you tell us a bit about OATS and your work at AARP?
Sure. So OATS is a social impact organization. The mission is to harness technology to change the way we age. And so OATS recently became a charitable affiliate of AARP. We wanted to add, one more acronym to the salad here. So, really what it is, it's a testament to AARP's investment and our expertise in helping older adults. We're still an independent 501c3, but the affiliation allows us to pursue our mission at scale. Senior Planet is OATS' national program for people 60 and older. That's where we offer the thousands of free classes, and now online access is available to anyone 60 and older who is able to get connected. The goal of the classes is really to build people's technology skills to improve their health, save money, make new friends, and really the goal is to thrive in today's digital world. So it's not really about the actual gadgets and apps for us. It's about what you can do with the technology. And that's what we really saw highlighted during this pandemic is now these things, these platforms were lifelines. They didn't have kind of that means to an end feel for many prior to, the pandemic. But we're also trying to stay aware and abreast of what else is going on, which is a lot of people don't have access and don't have connection and don't have devices. So OATS is also the nonprofit creator of a program, really an initiative called Aging Connected. So the goal there is to bring 1 million older Americans online by June of next year, so 2022.
Well, I just want to follow up on that. I know that in January, OATS and the Humana Foundation released a report called Aging Connected, Exposing the Hidden Connectivity Crisis for Older Adults, which analyzed why millions of older Americans don't have high-speed internet. Could you explain a little bit further a few of the key findings in this report and why there is a connectivity gap between seniors and the internet? So, Bree, we'll start with you, but then Maria and Charee will go on and see your perspective on this.
Yeah, happy to. The goal of the research and really the commission of the report was to start a national conversation about how to bring more seniors online. We knew, and anyone in the aging space was well aware that this was an issue, but the key findings were really compelling. Amid a pandemic that we know hit older Americans the hardest, and I think you mentioned in your intro, Dan, 22 million seniors over the age of 65 still lack broadband internet access, which is just an astronomical number. And 42% of Americans age 65 or older still lack wireline broadband access at home. Again, huge numbers. And we even saw in the report that some of those people, some of those individuals, that 42% live in areas where low cost or affordable internet is available to them. So we know that the issue is complex. And COVID has put things into perspective. And frankly, we view this as a public health crisis. We know that seniors are literally dying from loneliness, a lack of engagement. We saw just how important during the pandemic, the internet and being able to connect was imperative, right? So we know it's kind of also exacerbating the other inequities in our country. So, it's costing lives. Seniors are literally dying, but it's also happening in historically excluded communities, even more so. So older adults with less than a high school degree or an income below $25,000 are 10 times more likely than the general population to be offline. And Black and Latino seniors are more than 2.5 and 3.3 times, respectively, more likely to be offline. So these are compelling statistics. It really kind of puts legs to what we and anyone here working in this space know is important.
No, I'm trying to think of how we can compare this. And I'm trying to think of the time when the telephone was a luxury and not necessarily a necessity. What we have now is, this is now a necessity. This is not a question of it's great to have. You must have it. You've got to have it in your home or your living space, wherever you are. Maria, how do you see this?
I agree with you. We actually surveyed our service coordinators to get their, an idea of what they experienced at the properties. And they definitely saw an increase in interest in the use of technology, and basically out of necessity during the COVID-19 times, because they knew it was the only way to connect with their doctors or apply for benefits. So residents are aware that there's a need for them to step up and, try to learn or, find resources to become more familiar with the technology. I do think it comes down to affordability for most of them, and just fearful of, just the internet, like hacking or, getting their identity stolen or something like that. Just, lack of education, I would say it's one of the main challenges that they face and why they don't want to go online, so to speak.
Charee, how about you? What's your take on this?
I agree with Maria. They are fearful of the technology, lack of affordable internet, lack of technical support, and some of them are just unwilling to accept the new technology. But I think if it was affordable, they had the equipment, they had the training, it would be a lot easier.
Yeah, and I'm wondering if there isn't, wouldn't be a Manhattan Project, but it would be along those lines of there's an immediacy to fixing this problem, and just wondering how we can do this. Look, in our country, we don't have one system of residences. We have many. We have nonprofits. We have for-profits. We have folks who are living alone in their own places. They're renting. They own. I mean, it's not one size fits all. So there needs to be some kind of national effort. And I guess the question is, how do we gather the forces to move this effort in the direction that we'd like to? Bree, how do you see that? How is it going to come together?
It's daunting when you think about it. We know it's not going to, this divide's not going to close by itself. And conversations like this are really important. The public and the private sector are going to have to work together. It's going to have to take a lot of, ability to be nimble, and especially different types of residential settings. The buildings that SPM works in is a prime example of that, right? We did see some investment at the local level, particularly OATS received funding from the city of New York, where they distributed 10,000 tablets, and OATS was the one delivering the technology training. And I think that's a prime example of how to go to the root of where things are needed. But in general, our Aging Connected initiative is in kind of 4 distinct parts. We think that we have to clearly articulate the value of broadband access. We recognize that there's fear, there's concerns, and instead of saying you just got to get over that, get with the program, you have to validate the real things that can happen, the scams and the fraud that really is out there. And you have to give people opportunities to learn how to protect themselves, how to know when something doesn't look right. So the technology training is really crucial. We need to expand low-cost internet offerings. We're seeing a lot of attention paid to that by the current administration, so we know that people are aware, but we really need to kind of expedite the importance and kind of the wraparound approach that's needed. We need to really highlight where we're seeing the social inequity. Historically, when things have mattered, we've approached it from who is the easiest and the quickest kind of adopters, and we really need to take a closer look at where are we excluding communities that have been historically excluded from these conversations. And then we also need to actually create online community and experiences, right? A lot of people who are adopters of technology can speak to the online experiences and connection that they feel, right? And that needs to be something that is created with seniors in mind, and also, you know, to have those conversations about what people stand to gain by being online.
Yeah, there's no question. You know, for some of us, you know, you ask, you know, a child, a grandchild. Some people have IT directors, and they can help. But if you're in a situation where really you are living alone, even if you're living in a facility, it's tough to get that advice, which helps to incentivize the education process, and then to have people really be adequate or more than adequate even in how they deal with the issue of connectivity. Okay, this is for Charee and Maria. Both of you are based in Brandon, Florida at SPM Property Management. Charee as Vice President and Maria as Quality Assurance Director, overseeing the Service Coordinator Program. And among SPM's management portfolios are B'nai B'rith Apartments of Deerfield Beach, Florida, Glen East Senior Housing in Dothan, Alabama, and B'nai B'rith of Queens in Flushing, New York. So let's talk a little bit about the residents' use of computer technology prior to the pandemic. The senior housing residents all have computer centers, but there are staff in the center. Or would you depend on volunteers to help out? What is the average percentage of residents that has used those centers pre-COVID, during COVID, and how many residents would you estimate have their own devices or PC? So there's a list of questions here. Charee, why don't you go first?
Okay, so we don't have most of our buildings that are HUD funding. They don't have adequate monetary backup to pay for staff for the computer centers. So prior to COVID, we would have volunteers. We would partner with high schools, our local colleges. We would have the students come in, and they would help the residents learn how to navigate on the website, or they would teach them how to set up an email account. And that was productive. But again, it's about getting the technology to the residents and having them not be afraid of it or get frustrated with it, because the drop-down boxes and things like that they weren't familiar with. So there was a lot of frustration. I would say that, and also because we were dealing with volunteers, it wasn't on a regular basis. It was an infrequent as it could have been. I really think there's a lot of room for improvement there. We had maybe 2 to 5% of the residents that would come down to the computer centers before COVID. Of course, during COVID, they couldn't come down. We had the tablets for them to do telehealth, and I do believe they picked up on their technology because they were having to order groceries and things of that nature, but it's not where it needs to be.
Maria?
I agree with Charee. During COVID, the community rooms were closed, so they had no access to the computer rooms and the community spaces. So we did equip the service coordinators with tablets to help residents with telehealth and these kinds of things, but there wasn't a whole lot of interest in that. And I guess I can talk about the pilot thing that we did with telehealth later on. But I agree with Bree and what Charee was saying, that to bridge that gap, I think it's important to identify the generational differences. Some seniors are more likely to pick up on the technology quickly, or more willing to learn versus older generations. So we saw that as well with the use of technology. The younger residents were the ones that were more likely to come down and say, hey, I'm interested in doing telehealth with my doctor, rather than the older generations. Definitely smartphone use increased a whole lot more than anything else. As far as laptops and iPads, I don't think a lot of them, maybe less than 5% of our residents we have anything like that in their units. The majority do have a cell phone. However, looking at the notes and looking at the services that service coordinators provide, it is very common for them to come down just to say, I don't know how to send a text. I don't know how to answer a phone call. I don't know how to check my email. I don't know how to take a picture. So they might have the device, but not exactly know how to use it.
I understand that during the pandemic, you were able to provide iPads for residents of both the Deerfield Beach and Queens facilities to assist with telehealth appointments. That's what you're talking about here.
Yes.
But it wasn't as successful as you hoped, and you've laid that out. Did you have a situation where children would bring an iPad to a parent or a relative and say, "Here, we're going to try to set you up because we're not able to come in and see you. It's important that you do this." I mean, did you have any of that, or
We
not
did.
as much as
Yes,
one might
we did
hope?
have some family members that would come in and help, but also for safety reasons, they weren't getting a lot of visits, so they were pretty isolated from their families as well. But the residents that did have some grandkids or daughters or sons that knew a little bit more about technology did come and help them, but it wasn't very frequent. It was just a handful of residents that had that support.
And most of them don't have internet. They don't have the internet access. And even if their loved one brought them a tablet or a laptop, they didn't have the ability to connect. So therein lies the problem, is the affordable internet. We have to figure that out first, because then we can bridge some of the other gaps with the technology and training. But without internet, we're stuck.
Hey, it's interesting because before COVID, we were moving toward telehealth, and we all heard about that, and it was kind of like in a way, a new invention. And many people would say, well, how can we do that? You have to see a doctor in person, and all of those things. And then COVID came along, and it's not just for seniors. I mean, all of us, including doctors. I mean, I know that, in our own case, doctors were taking these calls or doing these calls where before maybe they would be easing into it. And I would imagine that with seniors who have all kinds of health issues, questions about health, about diet, about medications, that all of a sudden there was this kind of feeling of angst, really, of how do I handle this? Are there any other creative ideas out there, at least to get us through the end of this COVID period and then hopefully into a more normal way of living our lives? Are there any creative ideas that you've discussed amongst yourselves with other service coordinators that you will be putting into effect in the coming months?
Yes, so I'm working with some service coordinators. Actually, one of ours, what he did is that with the staff at the property, he organized an outdoors karaoke, and he used the tablet, connected to YouTube so the residents could follow along with the songs, and they had a really good time with that. So that was a really creative way to use the tablets. Other service coordinators are working on maybe connecting the tablet to a TV in the community room and do some like Zumba classes or some, other online activities that they can benefit from. And we noticed that telehealth wasn't as successful, so we were trying to push for them to connect with family members in different states via Skype or Google Meets, to get in touch with family again. So that seems to be a little bit more popular than telehealth.
Yeah, Charee, any new ideas that are popping up to help improve the situation?
I don't have any new ideas. Maria and I are bouncing them off each other. We're listening. We're hoping you guys have new ideas. Well,
Breana, I want to ask you to move to kind of a final question that is extremely important to B'nai B'rith. In terms of legislation, what is it that Congress should be doing to move seniors into this this existential 21st century technology? What is it that Congress needs to be doing, and what is it that we need to be doing to move that process along?
I think there's lots of things. The one that comes to mind is, the emergency broadband benefit is obviously an attempt to take a look at what the needs are, what can be done in partnership with the providers themselves, and actually bringing people on board. For those that aren't familiar, the EBB is a subsidy. It's a pot of money that once it runs out, it does not continue. I think Congress and this administration needs to look at, what does that solve for? Are there people who, for lack of the EBB, would not have internet access? And what do they stand to gain by having internet access? So, it's simple in nature. It's provide the access, make sure it's affordable, but also we need to be really realistic about, you can't just provide the internet. There has to be device access, and there has to be access to training, right? I think Maria did a really great job of talking about, we're focusing on seniors, which is appropriate, but we also need to think about our human nature. Most of us don't just want to go learn online banking just for the sake of learning about online banking, right? Most of us want to start from a place of interest, community building, how we can maintain those connections to one another. And I think we need to be more realistic about what is going to compel people to want to get online in the first place.
Yeah, Maria, any thoughts on that? Charee?
Yeah, as far as, maybe advocating, maybe something through an area agency on aging, maybe tied to funding, the Older Americans Act, maybe, kind of similar to the congregate meals. I know that for some of those sides, it's required for them to have one activity a month or something like that. Maybe just make it part of funding to have someone, and a staff member do classes at senior buildings or congregate settings, maybe start there. That would be, I think, a great avenue to reach more seniors, because they do attend these congregate meal sites. And there's a good pool of individuals there that go for social purposes and also to get a meal. So it wouldn't be a bad idea to start.
Charee, any thoughts? Anything you'd like to add to that?
I agree with Maria. You feed them, they will come. They will learn.
Well, I know that B'nai B'rith has a strong interest in trying to move Congress to take this issue seriously, to see how important it is, and then to provide the wherewithal. We've got the prescriptives. I think we know what we need to do, but we need, I think, to move this further along, and Congress can certainly be helpful in that regard. Well, Breana, Charee, Maria, thank you so much for joining me and talking about the challenges and the breakthroughs concerning technology and older Americans. Our thanks to Breana Clark, Maria Medley, and Charee Russell for joining me and delving into how older adults use technology in 2021. And thank you for tuning in to this conversation with B'nai B'rith. Well, if you enjoyed this discussion, make sure you never miss a program by subscribing to the B'nai B'rith YouTube channel, liking us on Facebook, and following us on Twitter. And be sure to visit our website, bnaibrith.org, to learn more about our important work. See you again soon. Take care.